In the original trials, for example, of some of the drugs in certain histologies like pembrolizumab, nivolumab, atezolizumab, often patients were treated until progression. Now, since, for example, in melanoma, at least 15-20% of patients potentially would stay on in remission, you could treat patients for 3, 4, 5, or 6 years. So in terms of the toxicity, the convenience, the economics, that's just not practical. So a number of trials then were done so that at 96 weeks or at 104 weeks, i.e. 2 years, you would just arbitrarily were done with PD-1 inhibition, you stopped, you went off and were followed. So the question becomes, how long should you treat? Could you treat for a year and then stop? Should you treat based on the results of scanning and then stop? So I reviewed the available data, which are mostly retrospective, which give us some hints of how long we should treat patients, at least with melanoma, and also probably other cancers like lung and bladder and head and neck. So the most data, as you might expect, come from melanoma. And if we go to the Keynote-006, the randomized pembrolizumab versus ipilimumab study, which was actually a 3-arm study, 2 schedules of pembro versus the standard ipilimumab in frontline melanoma, when patients achieved a complete response or a partial response and went off treatment, and there were over 100 patients in that category, and of course patients who were stable, which was a small minority, those patients would stop at 2 years on schedule, and then they were followed, and those patients did extremely well. The rate of remaining in remission was something like 90%. So the progression-free survival after stopping upon achieving stability, partial, or complete response in melanoma was outstanding. Meaning you could probably reassure your patients at year 2, good to stop, you'll be followed, the likelihood of relapse is low, and even if you do relapse, the rate of remission would be at least 50%. Now, how long those second remissions last, we don't know, but the bottom line is you're safe to stop at 2 years.